What I try to instill for all of my patients is the confidence to know that they are more than just their spinal curve. My name is Dana. I'm a physical therapist here at PTSMC, and I specialize in the treatment of scoliosis through the Rigo method. Scoliosis is a complex three-dimensional deformity of the trunk and spine. It's typically caused by a variety of factors, both environmental and genetic. Typically, we first diagnose it around puberty or during a growth spurt, as well as in the aging adult too. The original Schroth method was created in Germany in the 1920s by Katharina Schroth, who was treating her own scoliosis. She was trying different positions and just experimental breathing to see which would give her the best results and the best posture. Rigo concept is an extension and an evolution of the original Schroth method. The main difference is that Rigo heavily emphasizes both expansion and elongation to help with detorsion of the spine versus just using props and belts to correct that deformity. We first create a stable 3D postural correction to find the best possible position for your curve, and then we work to reshape the torso through different breathwork and expansion techniques. Creating that strength and stability while in that expanded and elongated position, you're heavily practicing that in order to integrate those corrected positions into your day-to-day life.
In a typical session, the first thing we do is hang from a bar. It's an exercise called the semi-hang to stretch out your spine. It feels really good. So already when I first come in, I feel like there's just a lot more space and less compression.
So in all of these positions, I'm teaching you to try to breathe into those collapsed areas of your curves. With any spinal curve, you have one side of your spine that's more prominent than the other side of your spine, and I need you to figure out how to breathe into that almost forgotten side. Our next step is to integrate that into different movement patterns and different strength training techniques that can help with that. So if you have an issue trying to keep your pelvis stable, I'm gonna find an exercise where you have to keep your pelvis stable while you're doing something else with your upper body, so you can figure out how to connect those two aspects of your curve while still breathing and just going about your day. A single treatment session usually lasts an hour with the entire plan of care typically spanning the course of about 12 weeks. An adolescent recently diagnosed with scoliosis is an excellent candidate, as this is the greatest opportunity for curve correction. I'm looking at you as a person and not just an angle. So if you're not able to do these exercises every day, it's fine. You just do what you can and know that this is more than you've been doing in the past. So you're gonna get more out of it than just doing nothing. Something is always better than nothing.
I spent more than 20 years not doing anything about my scoliosis, and yet when I did seek help, I was able to see dramatic improvement.
If you're looking for scoliosis treatment, visit ptsmc.com.